COVID cases rising across the country now. The CDC predicting hospitalizations could double in a month, with states like Arkansas running out of ICU beds and Mississippi and Alabama seeing their deadliest days of the pandemic. But there is some good news. 6 million vaccinations have been given to Americans in the last 7 days, as Johnson & Johnson just announced its booster shot vastly increases protection. Our Marcus Moore has more.
This morning, breaking news about the single-shot Johnson & Johnson vaccine. The company saying a new study found that antibody levels in people who got the shot and a J&J booster shot 6 months later increased ninefold. Prior research indicating immunity from the single-shot vaccines lasts at least 6 months. Experts saying the data shows that boosting is safe and effective. This, as an alarming forecast used by the CDC, shows that by this time next month, if more preventative measures aren't taken, hospitalizations could more than double across the country, and deaths could jump from 11,000 to more than 16,000 over the next 2 weeks. On Tuesday, some promising news. The White House announcing 6 million shots have gotten into arms in the last 7 days, the highest 7-day total the country has seen in the last 6 weeks.
We're seeing the greatest increases in states that had been lagging on vaccinations. In Alabama, Arkansas, Louisiana, and Mississippi, more people got their first shots in the past month than in the prior 2 months combined.
The news comes as hospitals in several of those states are struggling. In Arkansas, they're out of ICU beds for COVID patients.
Those beds are full right now. I know our hospitals are trying to bring some additional online, but that is a cautionary note for everyone.
Both Mississippi and Louisiana seeing their deadliest days since the pandemic began. Inside Shreveport Willis-Knighton Hospital, first responders facing unimaginable pressure.
If I don't show up tomorrow, there's nobody here to take care of this patient. There's nobody here to hold this phone and let them talk to their family the last time before we put a tube in them.
Here at Jenny Seeley Hospital in Texas, they have not turned away any patients, but the situation is dire enough that in some cases people are having to wait longer in the ER, and they're also using the hallways to make more room. This is clearly far from over, and the staff here hoping for relief. Marcus Moore, ABC News, Galveston, Texas.
All right, our thanks to Marcus Moore there. Emergency medical physician and ABC News medical contributor Darian Sutton joining us now to talk more about this. Okay, let's start with the breaking news of the J&J booster. What do you think? I mean, what's the impact here?
I think it's helpful. This story about antibody increases after the second J&J booster shot within their studies is a helpful hint at a larger question, which is what level of antibodies do we need to confirm immunity to COVID-19? We know that as time goes on, effectiveness decreases, and we can expect that vaccines are not 100% all the time as they wane over time. But the question is, what is the exact benefit? We see this part of antibodies, but we also know that Johnson & Johnson vaccines, as well as the Moderna and Pfizer, are still proving effective in keeping people out of the hospital. So we'll probably wait for more data. Hopefully they'll be able to release it soon.
Okay, we know how this goes. You need the data, then comes the FDA approval. So considering what we're dealing with right now, and there are still a lot of people that are getting infected, what do you think the timeline could be?
You know, I wish I could predict it, the exact date, but unfortunately, I do not have that information. We have to wait for that data, and I know that what will likely happen with the J&J vaccine is that they'll have to wait for more participants to participate so that we can see the results of that. But since the reports in April of the J&J pause, given that rare but important to acknowledge side effect, many people have chosen not to get the Johnson & Johnson vaccine, and that just prolongs the amount of time needed to collect information.
When we talk about collecting information, we talk about data. Is that for more effectiveness or safety reasons?
It's mainly for safety reasons. It also helps us to give a glimpse at effectiveness, but we want to make sure and confirm safety. Obviously, that's at the forefront of all of our questions as scientists. And then we want to ask the question in terms of effectiveness. How beneficial is this? And do our patients need it? And those are questions that constantly circulate inside of our call rooms in the hospital.
Now, you know, we've been talking about this CDC, this report that came out showing that the vaccine effectiveness has dropped 25%, and that's likely due to the Delta variant.
Absolutely.
So, you know, what does this tell us about how effective the shots are.
So when we look at that data about vaccine effectiveness dropping, we asked what group are we studying? And what they looked at was healthcare providers like myself, who were exposed at high levels of COVID-19 and constantly in that realm of high exposure. And so it can only be understood that we are, first off, the forefront of treating patients, and we're probably the most exposed. So that's where that question of effectiveness comes from. Does that relate to the overall population? We don't yet know because we don't have that answer. So I'm sure as time goes on, we'll start to see more and more evidence of this effectiveness and how it changes for the general population. So what's important to understand at the end of all of this is that the vaccines are still proving effective in keeping people out of the hospital. And as Marcus was just saying, that is our goal. We can't have these hospitals overrun with patients because it delays care and increases the risk of medical error.
Well, you and I were together on set when I was able to interview the CEO of Pfizer when the big news came out, this week. And I asked him this, and we talked about this. You wanted to know this as a doctor. If we've had the Pfizer or, Moderna doses, are we going to need a booster shot?
Yeah, so that is what the question is that we're all trying to cipher through right now. And so what we've seen is that the booster shot will likely be recommended coming September for the general population. The question is after that, will we need repetitive booster shots? And it can only be expected that we likely will, but that's dependent on a couple of different factors. Number one, in the future, what is the rate of incidence of cases of COVID-19? Number two, who are those who are becoming infected and requiring assistance after their vaccination, AKA their breakthrough rates. And so these variables are what we take into our minds when we're making a decision about who gets a booster shot and if it is needed.
Got it. And finally, 6 million vaccinations have now been given to Americans. That's pretty amazing.
Incredible.
So, and that's just in the past week, right? And now the CDC predicts that hospitalizations could double in a month.
Yes.
So and we finally have full FDA approval for Pfizer. So where do we stand at this moment with regard to moving forward? Because it seems like we get a little good news and then we get bad news.
It's a race. Delta is proving exceptional in terms of the amount of effort that is required in order to treat it. And unfortunately, it is increasingly transmittable. And what we know is that those who are transmitting it are unvaccinated. And so we have to focus on that group because they are the main drivers of infection, and more than 95% of hospitalized patients are currently not vaccinated. So yes, boosters are very important, but we have to focus on the low-hanging fruit here, and it is those who are not vaccinated.
I remember interviewing a nurse just a few weeks ago, and everybody that was in the hospital at that moment, she told me that those that were sick weren't vaccinated, and that a number of them from the hospital beds were saying, my message to America is get vaccinated. Yeah. So there's still those people that are very just reluctant to do it.
And they're still reluctant even when they come in the hospital, and I talk to them as my patients are reluctant still and concerned about the evidence and the efficacy. I try to reinforce it, but at that point it's usually too late. So I help to encourage them to talk to their family members and their friends about the benefits of a vaccine and explain the severity of this disease, and I'm hopeful that more people will understand that.
Dr. Darian Sutton, I'm glad you're our doctor.
Thank you.
And our contributor. Great to see you this morning. Thanks for being with me.
Thank you.
All right.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.